with the book. So we have published a book, step-by-step hair transplantation, that was primarily for novice hair transplantation surgeons, and of course we were given a lot of pearls of wisdom that we gathered over the last 10 years, so that everybody can get benefit out of our experience. And it is an ongoing learning process for everybody and any field. And hair is in particular where artistry is kind of more relevant, I believe, now than science. Science we all can potentially master of, maybe with enthusiasm, with knowledge, with attending meetings and reading books. But artistry is something is very, very difficult to master if you don't have passion. If you don't have passion, if you don't have the grit to do that, then probably artistry will not be mastered. And that differentiation between a great hair transplantation versus average hair transplantation is only art. And that forced us to leave the rest of our dermatology practice in 2012 and to focus only on hair, so that we can give the best of our version, best of our knowledge base to our work, and can potentially also be Emily, can you just take out your WhatsApp from you? So this is the book that I was talking about. So each chapter, we have tried to put down all our experience into the book, and we published some 2 years back. And a little bit, the first chapter is about evaluation, workup, and post-operative care, where evaluation is very, very important. Why? Because knowing only exactly doing hair transplantation is very basic of hair transplantation. You have to know that whether you should do or not, whether the patient is eligible to get hair restoration or not, the surgical procedure. Then one should be really master of the skin. We all know that the external part, which is the largest organ in the body, and skin harbors hair. And anything that happens inside the body, any organ like liver, kidney, blood, anything that gets reflected in skin and also hair. So the dermatological training of MD 3 years, or the diploma of 2 years, there we learn the dermatology proper. As I said, the skin is the largest organ of the body, and that shows signs and symptoms of anything that happens inside the body. So one has to be very, very great in the knowledge of the internal organs, then the skin, then hair, to understand what happens to them with internal diseases. Then understanding all those things, understanding how the skin behaves to different kind of medicines, how the hair behaves to medicines, whether it is a finasteride or minoxidil when it comes to hair, as well as how they're going to react to any surgical procedure. And there are a lot of diseases that affect body, like scalp. We call alopecia. Alopecia means loss of hair. So we have to understand the medical conditions, the surgical conditions, the inflammatory conditions, the autoimmune conditions. A lot of things are there in the scalp to understand, and the pathogenesis that happens to a lot of diseases, including androgen alopecia. And upon that, the signs of hair restoration. That means both preventing the ongoing hair loss and then getting more hair by transplantation surgical method. So this evaluation, workup, and post-operative care, that the first chapter of this book says the details. So I believe this chapter says that one should be master of the science, master of the internal organs in addition, and master of the drugs that are going to affect, that are going to potentially going to be given. Both surgical and non-surgical things should be under the control of the doctor. Then only he can do justice to hair restoration. That was the first chapter. And the second chapter is the method proper. Like we have published, as Dr. Nidhi Madam said, that this direct hair transplantation is not a new technique per se. This is a little bit of modification of the existing FUE, follicular unit excision, that was published in 2002. So when we arrived in the scene of hair restoration in 2010, by 2012 we realized that the graft should be planted as soon as possible, so that the chances that a living organ would grow back would be maximized. So with that concept, we try to change some ergonomics of the procedure, some steps of the procedure, so that we could implant the grafts within a few seconds of extraction of the graft. So that led to maximization of the graft growth, because we reduced the time outside the body. So that led to reduction of the desiccation, reduction of mechanical handling, reduction of infection, and that led to reduction of the damage. So this direct hair transplantation we published in 2013, and that of course we do that, and we are mastering, kind of say that we have mastered it. Every day we're improving, and that gives whatever the patient that are happy from our hands because of this concept of immediately planting the grafts after extraction of the body. So this is one step that you can see that in the same time, same frame, you can see we are extracting the graft from the donor area, as well as we are planting the graft, that is placing the graft at the imprimement site, so that the grafts are entering the body within few seconds. So as I said, it is not a new technique per se, but it is some minor changes were there, like in the FEV, which was published in 2002 by Bunsen and Rasman. They said that first extract all the grafts and store them. Then the second step is like make the sites, and third step is place the graft. So in this way, around 3 to 5 hours the minimum required for the graft to enter into the body again. Whereas in DHT, what we did was we made the slits first, so that the slits are ready to receive the grafts. Then, as I said, the picture just before this slide, that extraction and implantation could have happened simultaneously. So this ensured, as I said, a lot of improvisation of the hair growth. So of course, as I said, the artistry that will come later, that is very, very important, and one should master. I should rather, the one lifetime is not enough to master that, but try to master artistry. I'm sorry that there is some misfit of the literature in the slides, because I think there's a MacBook or something like that. Then of course, hair restoration is a cosmetic procedure. When people want to go for it, they want to go for a kind of very smooth selling in terms of experience. The pain, the post-surgery, kind of discomfort, and all those things one should master as much as possible to give least pain and least discomfort. So always, like the medical science, we all are like constantly working on that, how to give the least discomfort to the patient in terms of whether to preparing the patient and post-surgery, so that as early as possible he can go into his life and do his go ahead with his life. So this is very, very important. Rather than the most important slide of this whole the rest of my talk is the gateway to the face is this anterior hairline. That is the design. That is the how your no two faces on earth are similar. That means there is something of each face which doesn't match with the next face. So position of the hair contributes to customized face of a person. So whether the shape of the skull, all shape of the nose, shape of the eyebrow, or the cheekbone, or the malar prominences, everything, the tiny element of each part that contributes to a customized face. So when you think and you dive deep into all these aspects, then you understand that the position of the hair is also one important point that we should consider when you look at a face. Then other things which will force you to think about the position of the hair in hair restoration is the donor, which is usually from the back, is very, very limited for one lifetime. So you have a limited donor area. From there you have to pull out hair and place on the hair on the front and cover the scalp and potentially give a full coverage, so that the person's primary purpose, that the scalp should not be visible and should be looking natural. So all those things you have to keep in mind when you recreate the gateway of the face, that is the hairline, jaw. You have to keep on looking, keep on watching, keep on witnessing the naturalness, like the natural hairline positioning, the natural entry into the face varies from person to person. It is not similar. It is varies from my two kids, like one is 13 and another is 10. When I look at them, both are different. Like one has a little bit of flared of hairline, the other one has a very sharpish kind of thing. So so it varies from person to person, varies from races, and varies from kind of with aging, the hairline also matures, like without any baldness. So you have to keep on watching them, and this micro irregularity that gives the softness, that gives that naturalness, again, is a huge thing. Like those micro irregularities are also they also vary. So you have to study them, and you have to apply your experience, apply your whatever you have watched and whatever learned, whatever kind of things from watching them, and you have to execute that micro irregularity in such a way that it looks very, very natural. The very only 1 centimeter in the anterior hairline, that is the gateway, as I said, that is a zone, that is another line. So we should not be calling it a hairline, rather we should call it a zone. It's a misnomer, it's not a line. And that 1 centimeter, let's say around 6-7 layers of hair that is there, they again, they are graded in terms of the color, graded in terms of the thickness and the growth rate. They are very, very graded. So you have to go into that depth, to create a natural looking hairline zone. I don't call anymore, it is hairline zone. So if you see this picture, so this is a very irregular, kind of slits that you could see. And you have to keep coming, even after the transplantation procedure. You have to keep coming to watch whether you have done it right or not, whether you could do a little bit here and there to make it more natural. So, like at this stage of my career, like I spend almost about 2 hours every day on each patient when I do a procedure, just to make it correct, so that when after 9 months of, I call it hair pregnancy, after 9 months of hair pregnancy, when the patient comes back, I don't regret what I have done. And of course, there are many things that you should not be putting. The doublets or triplets by mistake. You have to have a huge magnification. You have to screen all the grafts that are going to the frontal part. A lot of application is there. Then probably you'll get something which will be very impeccable, where you will not make out the linear transplantation, or the patient will say like, doctor, nobody can make out our procedure done. So that's the target, that's the aim. And in conjunction with anterior hairline zone is, goes this temple reconstruction. Temple is, I consider, part of the hairline zone as well. It is very, very important. Like, if you look somebody who's bald, his temples are receded. That means the horizontal width has increased. The hairlessness has increased. So you have to reduce the hairlessness in a very tactful way, using very less number of hair follicles. And again, if you do it bad, it will stand out and it will be very catastrophic. You have to keep it correct, you have to keep the angle correct, you have to keep the curl correct, the hair should not be standing upside down, and right kind of hair should come there. The graded hair in terms of the growth rate, the color, the thickness, everything should be graded. And and you should be really extremely experienced to do it. If you don't have enough experience, don't do it. Do very small number, maybe like 10, 15. Watch it. You have to really think. Like, to me, it was very, very difficult in initial years. I would say, like, still it is, because sometimes you can't make out the curl. You have to really apply your, you have to concentrate, and with all your gadgets, your microscopes and everything. So you should know that the curl is correct. If the curl is upside down, I feel very bad when I get one hair on the temple which is growing upside. And if you do it correct, the gratification that you get is like immense. I would say, if the temple is done well, you will take away around 10 years away from his, aesthetic age, and it will be amazing in terms of the outcome. So temple is very, very crucial. One should try to do it, but if you are not experienced, don't touch it. If you have not done more than 1,000 odd cases of normal routine hair restoration, don't go into temple reconstruction to start with. If you put thick hair, they will look very savvy and very bad. So this is temple. As I said, the direction and angle and everything is very, very important, and you have to understand them, and you have to do it right, and then only it will be great. So next is very, very important. A lot of people, they feel like crown hair does not grow. Those people who do hair transplantation, they know that crown is the part of that is the skin that is part of the same human being. So how come that the hair is growing in the front? It will not going to grow on the back. It will grow the way it is growing in the front. So I think some people discourage the patient to think about crown, because they can do the artistry, or they can get enough hair, enough grafts in addition to the front to give a coverage on the crown. So somehow, the numbers are more, like patient when they used to come and tell that we have been told by other people that crown is not a bad area, the skin is different, the hair does not grow. And I was like, it is not true scientifically, and in our hands, crown does grow the way it happens in the front. So crown, what happens is they are like holes, and these holes are like sometimes one, sometimes two. I've seen 3 holes in some of the patients, where the holes would come from both the sides. They will touch at one point, then it will go away. If you see the ripples from ponds, like I'm from a village in Odisha, so we have a lot of ponds over there. So I just imagine how the ripples from both, they come and merge and then deviate. So those things are my imaginations, and whatever I've seen that. Again, crown is something you have to really imagine sometimes. In this patient, of course, you can see that he has some remnant hairs. He has some, this miniaturing hair which can show you how you should go at, but sometimes you have got a like total empty thing, nothing is there. So you have to imagine and recreate, and sometimes you have to put it on the left side or right side of the center. So those are very tactical decisions, so that you can go for a minimalistic approach where you don't have much hair. With less hair, how you can create a crown that you should, the patient should be accepting it. And like in this case, you can see that you have a great donor to play with. So you can go for maximization in terms of placing the grafts. You have to educate the patient that the crown where the hair they radiate from the center, it will never be looking very dense. And if they imagine like that, then you have to educate them a lot. And potentially, like you can do that a second sitting again to do more, augmentation of the crown. But the right side picture that you are seeing here is I'm okay with this. I'm okay with this, and this patient is also okay with that. And you have to reduce the expectation of the patient. You have to educate them so that they know that what is doable and what is not doable. So as I said, the hole could be at the center, the hole could be at the side. So you have to understand that. And this is one point that I want to tell here is in the crown, the central point, the hair is sometimes around 80 degree, 90 degree to the skull. But if you keep it low, like let's say around 70 or 60, then probably that will give a better coverage, because the angle of exit will be less, the hair will be lying on the scalp. And and while doing it, you have to digitate into the surrounding balding areas and be sure that you have not damaged the thinning hair, and you have enough magnification and experience to do procedure or place the grafts in between the existing hair. So this body hair transplant, when, as I said, the backside is a finite donor, this finite, and sometimes the requirement is more. And of course, with experience, sometimes the same donor area, some people can harvest close to 50%, some people can harvest 40%, some people could harvest 60% from the finite area, and still the back would not look like harvested. That would look, pre-harvested kind of scenario. So depending upon that, and of course the same team which is very experienced in extracting the grafts, they would be equally experienced to do a great job with minimum amount of grafts on the donor area. So again, you have to create an illusion of density both in the donor and the recipient. So in addition to mastering the illusion of creating the delusion of both density in donor and recipient, still sometimes there will be a deficit of scalp hair, the donor hair. So you have to go for other sides, and the second best of hair band is the beard. It is close to the scalp, and they behave in terms of a little bit the growth rate, the thickness, and everything a little bit like scalp. And rest of the grafts like chest hair, thigh, arms, and all, somehow we don't trust them, and their telogen phase is very, very long, and another is very short. So somehow in our hands, they have not done very, very well. We don't advocate, we don't do them much, but we do trust the beard hair. Again, all the beard hair are not great. Sometimes they will give you kind of they will surprise you. They will not grow. Some of the beard will grow very early. Some of the beard they won't grow only. So you have to try to kind of take a chance when you do beard. Try to use least amount of beard and never use them on the frontal part of the scalp. Otherwise, they will stand out. And be smart in mixing them thing. But if you are really mastered extracting the beard, you can go up to like 6,000, 8,000, 10,000 of graft taken from the beard, and you should have the right kind of instrumentation, you should have the right skill set. More than instrumentation, of the skill set to do it. The right angle, right traction, and potentially this is a picture. Of course, like from here we have taken around 4,000 odd grafts, and we have taken more grafts also from him. I don't have that picture here, I guess, but you can see that the minimum of scarring that is visible here. You have to search for them. It is not always the scenario. Sometimes some skin they pigment very badly. The PIH, the post-implant hyperpigmentation, very, very bad. It lasts up to like 5 to 6 months. And who would become PIH? The skin who develop this PIH is unpredictable. And some people have got a very dark skin, they don't develop any PIH. Some people are very fair, they develop PIH. So we have had very, very bad experiences with some of the patients, and we have really handhold them for 5 to 6 months. Still, the pigmentation lasts for even if all kind of treatments. So this is a chance that you have to take on body hair. Now they said never Dr. Prabhu, you have to tell me when my time is going to up. I don't know how much time is there for me. So, if you, yes, sorry, sir.
Please go ahead. You have time, sir. You
Okay,
have time.
thank you, sir. So, then as I said, this guy who had extremely baldness, like grade 7, and he had never had any kind of donor left because he had 3-4 procedures earlier. Only with the use of this beard hair, we could do a very wow kind of experience for him. And you can see that, of course, he's having hair again. And sometimes some patients, they have got a the beard is like very wary. In some patients, the beard is straight up. Not, I will not say very straight, but straight up. So if you can, and those people have got a straight kind of hair on the scalp, usually they have got straight kind of beard hair as well. But you have to take a chance, and you can start with doing only 2000 odd grafts and see how it is growing, how they're responding, whether they're showing up on the top or not. And once that has happened, then you can think of doing more. So, there is out of our experience that we have seen that don't be that much of over enthusiastic. We used to be when we were younger. We used to go ahead with 5,000, 6,000, 7,000. We have done up to 11,000 odd grafts taking from the beard and scalp at a time over 2-3 days. So now we realize it is not wise to do all those things. Go slow. Maybe go with 3,000, 4,000 grafts. Let's say somebody we are planning up to doing 10,000, 11,000 grafts to give a good coverage. So start with around 3,000, 4,000 odd and see how it is happening, and how once the patient sees the hair, he is also motivated to go further. If you do a lot of grafts at a time, then chance that you have not been diligent to each and every graft that you have placed. The team would be fatigued. The body will be reacting in some other way. You will not be knowing how the body is reacting, and maybe all the grafts will not be kind of anchored and be growing. So maybe I would say 4,000, 5,000 odd grafts are good enough to start with if you're planning for 10,000 odd grafts. And you should always try to use around 2,000 odd grafts in the first go when you think of doing a case like this, where almost 11,000 grafts are placed. So body hair is a very good resource, but one should be very, very smart, and you should know that it is good, but it is not everything. So people jump to body hair as soon as possible, which is not true. They should try to restrict themselves to the scalp hair, and of course, people, as I said, people jump to chest hair and other sides, and some doctors are there in the world. I know them personally; they do very well. But somehow I have not seen any patient so far in the whole world who has got body hair in terms of chest hair and rest of the part like arms and legs and underarms, and those hairs are lasting forever. So I don't advocate that. So now coming to the art and science of scoring the grafts. So this is this chapter when I was writing. I remember that this is the only thing which forced us to leave our dermatology practice, because how we are touching the skin, and that is the reaction of your traumatizing the skin is everything. That is the scarring part, the way it would heal, the way it would something called shock loss happen. If you are very blunt and very brat and very bad in kind of doing the job, then you'll be eliciting pressure in the surrounding tissue, surrounding hair follicles, and you can develop necrosis in the donor area as well. So we have had these kind of things in our hands in our early years, and that forced me to think day in, day out of the health of the donor area. And I started focusing after we have had a very good kind of growth rate. I focused on the donor area, because donor area is something which should be available for the potential future needs, and it should not look like something has been done on the backside. So to do that, your instrumentation, then the skin tone and skin tension varies from person to person, and so also the fat content and the toughness. So you have to customize the instrument, customize your punch. Sometimes and the hair, once they go inside, they are kind of, sometimes they are deviated inside, they're flared and they're splayed, and you have got straight hair, you have got a Caucasian hair, you have got Brazilian hair, you have got something Afro hair. So those kind of challenges will be there, how to extract them without damaging the donor area. So one has to really master, and I say always, your fingers should develop eyes. Just like when you play harmonium, we don't look at the keys always. So because we know that which keys is where and which key produces which kind of sound. So like that, when you do scoring or extract the grafts, one should have fingers in his eyes. That happens after doing thousands of cases, and intuitively you should be knowing which hair is going in which direction. And is it a theory or is it just my imagination? Answer is it is yes, it is imagination also, and it is intuition also. And one should have intuition, and that happens, I think, if somebody marries this work, whatever somebody does, whether somebody does hair restoration, any other cosmetic work or non-medical work also, if somebody marries his work, then he will become one with that. So I think that is the crux of what we do, is marrying the work. And if you see here, the multiple steps are there. I try to fragment them into alignment and engagement and advancement, and you should centralize, but sometimes even centralizing also is not enough because there is playing within. So you have to know that how much traction in that particular patient you have to keep on the skin, whether upward or downward, or at what angle. The angle of exit also varies from side to side of the same scalp. The temporally different, the occipital different, and nephrologically different. All the areas different. Different are the beard also. At side locks is different, and chin different. Everywhere you have to look at that, and you have to extract 2-3 hair follicles graft. Then understand how I should align. Whether I should use a sharp punch or a semi-sharp, like kind of a surrounded punch, or you should have like kind of U punch. A lot of punches are then you have to customize your own step at that point of time, and try to extract the grafts without any damage. So yeah. Then here the graft handling, as I said, the most crucial thing was extracting the grafts and planting the grafts as soon as possible. So while doing that, why we do all those things, extract and plant as soon as possible? Because the graft is a living tissue and it should be planted into the mother tissue and that's the scalp as soon as possible, so that it is secure in the mother tissue and does not need any kind of external support in terms of some storage solution. They have got some enhancers, life enhancers like ATP solutions and hypothermals and all those things. Those requirements have reduced by doing immediate transplantation. But we should all know, and not only the doctor, but also the assistants, the people who assist, they also know that graft should be handled very, 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 very carefully. It's a very minor microscopic structure, 3 to 5 millimeter, and if it dies, we will not know because it does not create any sound. And we'll only know after 9 months that the hairs have not grown. So extremely delicate, extremely diligent, and one should like, if one graft is killed or one graft getting damaged, in my team we consider that we have murdered somebody. So that kind of religious phenomena happens in our facility when we do it. And everybody, whether the doctor, whether the nurses, whether the technician or nurses, they all know that each graft is one human being to us. So each graft counts. So the handling should be that delicate, just like a mother carries her baby. We handle the grafts in that way. So what we do is, to ensure that the grafts are not being damaged, we use an implanter, wherein this implant that we use is made by Dr. Sanjeev Asad, the most intelligent hair restoration doctor that I ever met in my life. So what he does, what this needle of his is like kind of the lumen of the needle is opened up, and we can load the grafts inside. Once the graft is loaded into the implanter, then it is safe. You can see the pictures that different steps. So it is safe inside the lumen of the implanter. And already, as I said, we make pre-made slits, and these pre-made slits, they receive the grafts, and without much kind of handling, you can see already the slit was there, and this is being pushed. Once in the first push, the loaded implanter goes inside the skin, and we just unload it from the top, and it gets placed. And when you see it, there is soldering. The epidermis of the graft solders over the epidermis of the skin, so it just like goes and subtly fits. And this part of course falls off, and that ensure that there is no tenting or there is no pitting. So tenting and pitting is something very, very important. If you don't do it well, then the hair would grow, but there will be some tense kind of thing around the hair follicle. And to avoid that, you should just kind of ensure that the hair is fitting into the epidermis. So there could be some known complications and some unknown complications, and one should be aware. One should have read the theory. One should have done internship with veterans, and one should day in day out think of them so that he can anticipate what is going to happen. He can anticipate what is going to happen in aesthetics or any kind of other complications and try to do that. And I think like people who are very, very qualified, they know the medical complications. And but as I said, the aesthetic part is very, very important. We should know about the how to grow right hair at right point. And if there is thin hair should come on the hairline, they should come a thin hair. It should be thick hair. If the hair on the the top, it should be thick, then it should be thick. So in the scalp also the hair quality varies, as I said. The side locks are different in terms of color, growth rate, and thickness. The same thing on the hairline and the upper part also. So when you restore, you should try to get those exact kind of characteristics of the hair and place them. Otherwise, yes, you'll have hair, but you'll have a very unaesthetic look. And I feel very, very bad when some unaesthetic thing happens. And one should keep an eye into the aesthetics part and try to keep on improving on each front. So yes, these are some potential kind of things that you can find. You can have, the superficial staphylococcal infections. Very, very rare though. Like this is one of the patients, out of our 7,000 plus patients, this is I think one patient that I remember that we developed in our hands. This, and we were scared. Definitely, we were giving him Augmentin, which usually covers everything, but we were scared. We added some doxycycline to that because I was like, there was nothing that I could think or imagine. But it settled within 2 to 3 days. So if you develop something worse than that, I think you should definitely take help of surgical friends, surgeons. But somehow usually like scalp is so vascular in the upper part of the face and scalp that.
Dr. Sethi?
Yes, ma'am.
If I could interrupt you, you have 3 to 4 minutes.
Okay, ma'am. Thank you so much for giving me this
Thank you.
Yeah. So. Yes. So I would like to go to this something very interesting topic. The last thing that I want to tell you was female hair restoration. So everybody knows that everybody does, and everybody has mastered the male hair restoration. But females are also, are candidate of hair restoration. In whether they're to lower the hairline like this, the congenital high forehead. If she wants to lower it, yes, she can do that. And again, same things should have been kept in mind that to make it look natural. This case we did some 3 years back, and you can see the hairline is good, but I could have really softened it. And as I said, with each case we are improving, and we have improved, and we are improving to soften it. But yes, whether it is a PCOS where the central part is very wide, you want to fill that, or give a new hairline with a congenital big forehead, you can think of doing it, and you can really do it. And of course, a little bit challenging eyebrow transplantation, you can do that also. Eyelashes also, and scarring alopecia. Once you have evaluated the scar is kind of the disease is burnt out, then you can, after test it up, you can do that also. And of course, the book has in our book we have got everything: how to document your case, how to do photography, and setting up a center. And yeah, thank you so much.